Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'll be giving you our update for our local area with regards to COVID-19, talking a little bit about where we've been over the course of the past few weeks or so, updating you on some current numbers in our community, and then also talking a little bit about what we've got coming up over the next few weeks or so. Just starting off with our general numbers, most importantly, we initially start off with how many total we've had, which has been around 3,500 total positives since the beginning. But the important numbers we always go back to are the positivity rates. And the positivity rate for all individuals is around 2.8%. And then for unique individuals is around 8%. That has changed dramatically over the course of the last 4 weeks or so. If we look at where we have been even as recently as 4 weeks or so ago, that number is about 1/4 to 1/5 of what it was previously. And what that tells us is the number of people that are turning positive and the number of active cases that we have continue to decrease. If we look over the course of the past week or so, the number of active cases has been down in the single digits, which is dramatic compared to where we were a few weeks ago with as many as 300 to 400 people that were active in the community as far as infections were concerned. Having that number be so low helps us in a number of manners. It helps obviously with local spread of the virus. We've seen a number of factors that have been contributing to that decrease, not the least of which has been the vaccine rollout. We've got almost 14,039 total vaccines that have been administered throughout our community. That number is dramatically higher than what we would have expected when we started this back in December. Over 14,000 vaccines administered during that period of time means that all of those individuals, combined with the individuals that have already had the virus, basically increases the number of people that are immune in our community, and that has dramatically decreased the spread. The other thing, obviously, has been the measures that we have all taken, including masking and social distancing and all the personal hygiene issues that we have been following, have also had a dramatic effect on lowering things. I had a number of individuals ask me over the course of the past few days or so whether continued masking is going to be enabled over the course of the next few weeks. And the answer is definitely it will be. Despite the fact that we see decreasing numbers, we will be discussing how that will be playing out in our communities over the course of the next few weeks. But we certainly encourage people to continue to be cautious and follow those guidelines, because as we progress over the course of the next few months, if we continue to see those numbers drop and more counties within Indiana go from orange to burnt orange to yellow and into blue, we will see a lot of the precautions and the discussions of removal of some of those mandates and the openings improve. We were, as recently as 4 weeks ago, the majority of the counties in Indiana were red, moved to orange, then to yellow, and then gradually into more and more counties turning blue based on those positivity rates. So we feel like all of those things are very encouraging. Some interesting things that have come up with regards to the vaccine. The Johnson & Johnson has released and been approved over the course of the last few days, and we will be awaiting to see what happens with the allocation with regards to that over the course of the next week or so. Now, fortunately, we've been very lucky with our community that we have never run so low on vaccine that we haven't been able to fulfill the appointments that have been scheduled with ourselves through Pfizer vaccine, through the hospital, or Moderna through the health department, which is United Community Methodist Church. We've been close a few times as far as the delivery services bringing those vaccines in, but we've never run so low that we weren't able to administer those. So our allocations have been going well as far as vaccine. We encourage everybody to make sure that they get signed up, ourshot.in.gov. You can also do it through the CDC's website and find your local vaccine locations. We know that a lot of our individuals and friends across the border into Illinois have had challenges obtaining that vaccine. And although we've been doing well here in Indiana, there have been some difficulties with allocations and where those vaccines have been administered in Illinois and some of the surrounding states. So we would encourage you to look out and look to your local resources, including your health departments, and in some locations over in Illinois, also with the pharmacies, to make sure that you're getting every opportunity to get vaccinated. As we go over the course of the next few weeks or so, we'll see what the Johnson & Johnson allocation looks like here in Indiana and how that will be administered. Adam had updated me earlier today on the fact that we have openings this week on the 3rd as far as opportunities to get the vaccine within our clinic. So we would welcome people to please get online and take that opportunity to sign up. Would you like to join us today, Adam? We've gone through the usual stuff, so welcome.
Pop quiz
we're-
to see if we say the same thing.
Yeah, exactly. So we've been through our usual numbers, talking a little bit about vaccine. I hadn't touched much on bamlanivimab and Regeneron, but really looking at where we've been, those numbers have been very minimal. Maybe just 1 or 2 of those administrations per day is what we've been seeing lately.
Sure. I think when we looked at last week, in the 10 to 15 range for the week, and we were running 50 to 80. And a lot of that ties to positivity rate. I'm sure you covered being down and just overall transmission being down. But as we continue to see, there's an at-risk population that has not been able to get vaccinated yet, or has chosen not to be vaccinated yet, one or the other. And certainly monoclonal antibody therapy helps expedite recovery, helps keep patients out of the hospital. Have seen very, very few side effects, anything with typical infusion of any fluid type of things, but overall a really great treatment that kind of got overshadowed with the advent of vaccine, but it's been in its own right, a phenomenal advancement in medical care for COVID has been the monoclonal antibody therapy.
We talked a little bit about the number of active cases being in the single digits over the course of the past couple weeks or so, and that's also been reflected in what we've seen with our inpatient care as well.
Yeah, inpatient census all of last week and going into this week was in the single digits, 2-3 patients, even down to 1 patient in the hospital. And I can't recall since mid-March of 2020 having numbers that low. Even when we had very few cases, we had a few patients that were in the hospital requiring ICU level of care. And fortunately, we have seen all of those trends from a community transmission follow suit with the inpatient side. So really a lower acuity of patients in the hospital. And that's given our staff a much needed reprieve, able to take a breath, because it's been a long 9-10 months of caring for some very, very difficult patients that no one was prepared for. So to be able to step back and take a breath has been very welcome during this time, and which was where we throw in we're cautiously optimistic. We're not out of this. It's not over. Nobody has declared the pandemic end yet. The governor actually extended the executive order through March. From a federal standpoint, they're continuing to push vaccine and also extending the declaration of a national emergency. So the next few months, we hope to continue to see that moving towards that direction to where we really can identify a date that we can mark an end to this.
Yeah, and I think that's really from a prognostication standpoint what everybody wants. They want to hear from us when it's going to end, when the masks are going to come off, when the sheet will be pulled back. And unfortunately, we don't have any of that information. It's to be continued as we continue to look at those numbers. The thing that's important to look at, and this is reflected in kind of where we were last year at this time, roughly a year ago, this was all kind of exploding. And to look at the fact that when this hit last year, we were just coming out of the winter months, which is our normal viral spreading season. And one of the things that's kind of interesting to look at that you and I discussed over the weekend was the number of flu cases that we haven't had this year. And so I've had a number of people tell me how sick and tired they were of masking and all the social distancing and everything going on. But one of the strikingly absent things that has been in the ambulatory world is the near complete absence of influenza and a significant reduction in our normal childhood illnesses that spread throughout the schools, gastroenteritis, all these types of things. So I think it's very interesting and telling to see what the effect has been on nearly all the other viral things that we see that typically spread through the winter months that have been nearly absent as a result of our COVID precautions.
Yeah, it's really been phenomenal results when you look at the impact on the influenza season. You know, as we were sharing over the weekend, last year our medical group ran point of care flu test, 4,000 plus tests, over 1,000 positives. This year, we've had 4. And with the false positive rate, we're not even sure that those 4 were really 4. We very well could be at 0. And so when you look at how can that happen, well, influenza vaccine percentages were a little bit better because I think people were more, okay, let's get the flu vaccine in case I get COVID. But the flu vaccine itself is no more effective than what it's been in the past years. I mean, it's still is hit and miss, as that's a scientific guess in which strains they're putting into that flu vaccine. It really is public health measures that travel, masking, distancing, hand hygiene. It's not one measure has done it. It's multifactorial that all of those measures have really cut down on the flu season, and that's something that we're going to learn from, and that will continue to be the case going forward. Now, does that mean every flu season we're going to shut everything down?
Let's hope not.
Absolutely not. But it does mean that as a community, as a society, and globally, that we're more aware of viral spread and what that leads to. And I think we'll see diminished flu seasons for many years to come because we know how to really stop that transmission at a point that has led to next to nil influenza. And that's not just local. I mean, those are national and state numbers that are reporting almost no flu season across the United States.
So as we come out of the winter months, as people are outside more, as people are getting some sunlight, some fresh air and so forth, we generally see a lot of that viral season diminish anyway. So we've got several things that are going for us as we continue over the course of the next couple months or so. Number one, over 14,000 vaccines administered is tremendous. The fact that we've had our population that has already had the illness and has natural immunity to that as well. The fact that we're coming out of our normal viral season is tremendously helpful. So we've got several things that will be going for us. Now, as Adam said, unfortunately, we don't know when the sheet will be pulled back, when the masks will be taken off. Dr. Fauci, unfortunately, kind of rained on everybody's parade a week or so ago, saying that we will all be masked well into 2022. I don't necessarily think that will be the case, and one of the rate limiting factors that Adam alluded to was the executive order and the state mandate. And so what we will ultimately see is discussions over the course of the next few weeks as more and more counties move from orange to yellow and yellow to blue. We see that higher percentage going across our state, that those things will be taken into consideration, because really those are public health people that have been sitting and not doing anything. Really, and waiting for the next big thing to happen. Really, those are the folks that deserve the praise of coming up with these measures and basically having these plans ready to be enacted and in place. And this is sort of their Super Bowl. They're helping us and coaching us to say, here's when we should do this, here's when we should do that. And so really, as we go over the next few weeks, those discussions will still be ongoing as to when those mandates get pulled back.
Yeah, and I think when you look at how restrictions ramped up, it started with you need to wear a mask when social distancing is not possible. Right. You need to wear a mask indoors. And then it became mandatory masking everywhere. Some of that was because we couldn't be compliant with the other rules. But as we start to see those discussions around relaxing, this is purely just somewhat of kind of my opinion of what makes sense and what folks are talking about, is that we will likely see a reduction in masks needing to be worn outside, and then a reduction in masks needing to be worn in large spaces with good ventilation where distancing can occur, but masks will still be required if you can't socially distance. And the same way that restrictions ramped up, they will ease back off. There won't be a date where our governor or Dr. Fauci or even the president state no more mask. It will be a slow, we got here through slow progression of restrictions, and it will be a slow relaxation of restrictions to remove that. But we do think that we will see that happen over the course of time, and certainly, as you mentioned, as we move into spring and summer, best disinfectant is going to be out more, the sun and warm weather and being outside. And so ideally we'll be able to see that. And those are the discussions that are starting to be had, which is a good thing.
Yep. And one of the things that has been in the news quite a bit because they need something new to report on is all the new viral variants and so forth. This is nothing earth-shattering. We've anticipated this really since the beginning, and all viral infections mutate, and as a general rule, they become less virulent, but there have been hot spots where there have been more virulent virus that has either been more infectious or more deadly. And the important thing is that the studies are being done, research is being done looking at what the current vaccine is that we have now, what the monoclonal antibody is that we have now and how that applies to those variants.
Sure. And there is history of mutation and variants of viral illnesses that do become much more virulent. Fortunately for us, prior to COVID, those also were not transmissible from human to human. I mean, that's where the big issue has been, is that COVID combines high transmission and a level of virulence that can be potentially fatal. That combination, it's usually high transmission, doesn't make you very sick, or low transmission but can be fatal, but you can't catch it. This combines kind of the two. And yeah, certainly the variants are being tracked. In all likelihood, other viruses have had similar variations, but we know that there's nothing in the world tracked like COVID. I mean, every scientist that is a virologist is looking at COVID and what it's doing. Good news is vaccines not only are shown to be effective against the UK variant, which is the one that's been transmitted the most, but even looking at mRNA technology with vaccines and the way that we can adapt is, if a variant were to emerge that could escape the vaccine and render it non-effective, essentially, what we know is that a new vaccine could be produced in a matter of a few months, rather than we start all over and it's going to take another year, and then there's the concern of safeties being cut, which wasn't, but there becomes that concern. We know that now there is a framework and a structure in place that making small tweaks to the vaccines allow us to respond much quicker.
Yeah, and thankfully, as that has been rolled out, as we've seen more and more people that get vaccinated, and the safety of that continues to be reinforced, we have that ability, that mechanism in place, as Adam said, that as we continue through the next season and the next year and all these things change, that we have that ability to adapt as well. So again, people frequently will ask, well, should I wait to get the vaccine? And the answer is no. We want to get as many people vaccinated now as we can, because as we talk about that concept of herd immunity, we don't need 100% vaccination of the herd to prevent spread. What we need is the highest percentage in the most rapid fashion that we can get, and then basically that transmission shuts down. Right. So that's really what we're shooting for here. There's not a lot of utility in waiting to see what's going to happen and waiting to get a vaccine. There are a number of people that are kind of waiting for what would be considered the traditional vaccines to come out. But what we have seen really in the initial mRNA vaccines is that they're extremely effective. The side effect profile is extremely minimal. I know that myself, my family, all the people that we have been involved with through clinic, this was less imposing than a standard flu vaccine. Right. or a standard tetanus vaccine. So we're very thankful that that rollout has gone as well as it has, and the closer we get and the higher percentage of our population that has either had the illness and has natural immunity or has had the vaccine, then the transmission basically gets squelched. So that's really what we're shooting for. As we kind of move along, visitation policy, that was changed in the recent past. Right. And has softened up in the inpatient ambulatory world. Would you give people kind of an update on where we are with that?
Sure. Yeah, last week we expanded our visitation policy to allow one visitor with a patient across any of our services, so across all aspects of care, whether that is outpatient, surgery, inpatient, can have a visitor with you during the care being received. Still go through the screening process and still want to make sure that we're being kind of aware of our surroundings and sitting together, and it's not open visitation. It is restricted, but we are trying to balance the family and caregiver being able to be there with a patient, along with keeping traffic low and still being cognizant of, while transmission is low and things look really good in the community, 8.7%, I believe it was, yep, for our unique individuals. So it's not that there's no transmission. So we still have to be aware of that, and safety is our top priority. That's evaluated every week, and it is actually something that we look at with our community patient safety coalition, which is Southwest Indiana hospitals all get together, and our visitation policies are aimed to be very consistent across all of those hospitals, and also in accordance with our Indiana Hospital Association to make sure that we're looking at what's right for each region and visitation for those regions. So in that southwest area, you should find pretty consistent with that visitation. It's 10 a.m. to 6 p.m. on the inpatient side as well, and continue to look at those hours and being aware of making that doable for families, but also protecting our patients and our staff.
And as Adam said, one of the things that's been, I think, very appropriately matched is regionally how things have been dealt with within the state. When we look at what the conditions were early on within Indianapolis and northwest Indiana versus where we were here in southwestern Indiana, things were very different. And we fully anticipate that as things open back up, there will be regional differences between how we deal with things here versus Indianapolis versus in the greater Chicagoland area. Right. And so as that progresses, be aware that where you live and what the circumstances are within your county and within your region may be very different as we all prepare for a spring break and people who will be potentially traveling and going throughout the country. That's also very important to realize that there will be regional differences in what the numbers are. So what we are telling you is happening here right now may be very different to what the conditions are where if you travel in Florida or Texas or someplace else. So it's important to be aware of that and plan accordingly as to what your travel plans will be and making sure you're keeping your circle of people that you will be around safe as it can be.
Yeah, I think that's an excellent point. And it's worth noting, I have a high degree of bias because I was involved here day in and day out. But I have colleagues across the country that are in larger cities, Chicago, St. Louis, that their children have not went to school in a year. Yep. They've not had activities in a year. There are multiple museums and events that are shut down without a tentative date of rescheduling. It's very easy to look here and focus on kind of what's been taken away, what's impacted. But on a grand scheme of things, I can tell you that there is a lot of envy for this region and what we have been able to do safely in having things open and seeing events starting to be planned in new safe ways. And it's very easy to say, oh, well, it's changed and COVID's still impacting this. But the fact that we're even having those discussions is far ahead of where many, many areas are.
Yeah, and what Adam's talking about really speaks to one of the things that has been hovering over this from the beginning, which is the mental health of our community. Our children, our adults, our teenagers, our population over 65. It's been challenging for everybody. We would be lying to you if we told you that we hadn't been stressed and had difficult times over the course of the past year. We all have. But it's important to realize how well things have gone and how good things are looking now, and realize that there is a light at the end of the tunnel, and it isn't a train that's going to run us over, and so hopefully we continue to progress. And as we give you updates each week, and those statistics will help to reflect upon where we've been, not to be doom and gloom, but also to help people realize that things continue to improve. Any other things we need to talk about before we hit the phones?
The only other thing that I would mention, and you may have touched on it, I know you mentioned over 14,000 vaccines, but as I look at the schedule, I can tell you that we have open vaccine appointments this week, starting Thursday, which hasn't been the case for a number of weeks. So if you're eligible, have not signed up at ourshot.in.gov or called 211 to get your vaccine, and there's hesitancy, talk to your primary care provider, call our triage line, which is also a support line for COVID questions and can help to align you with whomever that is to speak to, nurse, physician, pharmacist, whomever you want to speak to about the vaccine. But we've got capacity. We want to continue to move that forward, and certainly that is the path forward. And as we continue to talk about the events and those types of things that everybody wants to get to, there's a direct correlation with stepping up, getting vaccinated, protecting our community so we can continue to do that. And we're even seeing more allocation of vaccine and more capacity. So we want to continue to move that forward.
Yep. Great. There are a number of people that are maybe younger but have medical conditions, and that's really the population that's kind of getting queued up and ready to go, because that population kind of has been pushed down the row for the course of the past few weeks or so. So we are eager to see that open up and get access to those individuals as well. Tiffany, did you have questions for us?
Yes. maybe real quick, discuss eligibility for the vaccine.
Sure. So current eligibility is still age-based. It is 60 plus, along with healthcare workers, first responders, and then the state is facilitating special populations that are eligible, such as dialysis. That process works a little bit differently in that they're communicating directly with dialysis centers because any dialysis patient has to be set up with a dialysis center. They want to coordinate that with dialysis schedules and even be able to administer the vaccine during that event rather than coming to the clinic. But 60 plus, and then those special populations, the announcement that was made as to what would come next would be that 50 to 59 incrementally based off of age, because I believe that was listed to be 1 million plus Hoosiers, so it's a big number. But starting to look at diabetes, COPD, congestive heart failure, anybody that is active cancer treatment, those populations that are at high risk due to immunocompromised chronic diseases. So that'll continue to move forward. Ideally, we'll see more communication this week from the state about how we open that up, since we are seeing that we have capacity and we are seeing more supply. But right now it is 60 plus. Ourshot.in.gov is a great resource to see. As soon as you go to that site, the first thing you will see is eligibility, and it will list your eligibility. If you think you're eligible but not sure, primary care provider, contact our triage line, and we will help to guide you if you are eligible, or if you are not, it's kind of where it looks like you will be eligible. We don't know the actual date any sooner than when it comes out. That's a pretty protected amount of information. But as soon as it comes out, we update our site. We send something out generally via social media, and then Our Shot site updates as well.
There have been a number of individuals also that have kind of been waiting in the wings, who have maybe had the illness over the course of the past few months or so, that have pushed off getting the vaccine because they basically have their own natural immunity. And we're at a point now, because the allocation seems to be good, that those individuals, if they're ready to come in and get vaccinated, we certainly feel like that's appropriate at any time. Many individuals have said, well, I heard I'm not supposed to get the vaccine for 90 days. That is somewhat of an arbitrary number of assumed immunity during that period of time that we know that you should be protected with your natural immunity. But I think at any point in time now that we're seeing openings in clinic, there's more availability. Really, if we look as recently as 3 weeks ago, we were concerned about our allocation of vaccine. That is better than what it was 3 weeks ago, both on our side, the Pfizer side, and on the community health clinic on the Moderna side. So please, if that's something you've been kind of waiting on, we would welcome you to come in and go ahead and get set up for vaccine.
Right.
Now, someone did ask if there are openings that aren't being filled and they're not in that eligibility group, is there a chance that they could be put on a list or anything to be called in to get that vaccine?
So we're going to have discussions at a state level about that this week, and asking how we continue to push that forward. The message to this point has been very clear that consistency across all vaccination clinics within the state needs to be maintained based off of eligibility. So we don't have the leeway or authority, because the vaccine, in essence, is coming from the federal government, and then to our state, who is saying, we'll give you this vaccine if you follow XYZ rules. So we'll continue to have that discussion, but locally at the Good Samaritan Clinic, or even at the health department or Walmart clinic, we don't have the latitude to expand on eligibility based off of vaccine. And one thing I want to make sure is very clear: this does not mean that vaccine will be wasted or thrown away. It is stored in the appropriate storage to where it is good throughout the expiration date. We only pull it out as we use it. So this is not we'll be wasting vaccine. Very, very proud that over 14,000 vaccinations delivered, and we have not wasted any vaccine. It has all been administered to someone in the community.
Someone asked if they can't make their second appointment for their vaccine, how long do they have to get that second shot?
So ideally, there is a 4-day grace period. So here at Good Samaritan, the Pfizer vaccine is a 21-day separated 2-dose regimen. So basically, you would have day 21 to day 25. That is ideal. CDC has came out and stated that you can get that second dose up to 42 days after the first dose, but the focus is really that 4 days. The 4-day grace period is what's been known as best efficacy, best regimen for the vaccine. So don't take it to mean that, oh, I have 42 days. No, you have 25 days. 42 would mean that something really catastrophic happened. You end up in the hospital. Ends up that we don't have any vaccine and we have to space doses out. Those just simply don't apply except in rare circumstances. So 21 to 25.
Yeah, and that's been our advice in the ambulatory world. If people are acutely ill, they don't need to hit that appointment for 2 reasons. Number one, we want to give your body enough time to recover from its illness. So I had somebody last week with appendicitis, somebody with diverticulitis, somebody who had pneumonia. We want to give them enough space to go ahead and recover from that. Second, of course, is we don't want those individuals coming in and potentially spreading that illness to other individuals within the clinic. So as Adam said, the real stop point is not to get it early. So when we look at nearly all other vaccines, adult vaccines, childhood vaccines, so forth, the key factor is to not get it too early. So once you have passed that initial deadline, there's some latitude beyond that to get it later. Ideally within those first 4 days after your deadline is important, but not to get it early. And if you're acutely ill, just discuss that with your primary care provider. There's all differing degrees of illness. If it's something that's significant enough, we'll probably push that off.
Now, someone said that they got their shot on Saturday, their second one, and asked if they need to keep social distancing even while wearing a mask.
So all the same precautions still stay in place. And people will frequently say to me, then why am I getting this vaccine if there is no benefit to it? And the benefit is twofold. Number one, that you won't get the illness. And then the other presumed benefit is that you won't potentially transmit that illness. Now, unfortunately, we don't have great data on that yet. What we consider to be fully vaccinated is 2 weeks after you've received your second dose. But what we want people to understand is as we continue to progress over the course of the next few weeks or so, the biggest benefit right now is if you get exposed, then you don't have to quarantine. So that's the best thing that we can really offer you right now in terms of the benefits, besides obviously not getting sick from the illness. But realize that we're trying to get as many individuals vaccinated as we potentially can to reduce that spread. And then as we go over the course of the next few weeks and things lighten up, then we'll come out from under the shield of precautions gradually, and we'll all be happier as a result of it.
Now, someone's asking if we know anything about plans for vaccine for children yet.
The only information we have so far is that the approved vaccines, Pfizer and Moderna, and actually I believe the J&J vaccine that was just recently approved, they have started to expand their study populations to include children. Right now, the FDA approvals are still for 16 and older for the Pfizer vaccine and 18 and older for the Moderna vaccine and the J&J vaccine because they haven't submitted that data to expand on the FDA approval. There's some discussion, and this is purely discussion, that all of that is being somewhat timed to have that data released and FDA expansion prior to next school year. And then there will be probably some communication as to vaccine expectance of that time frame. But that's pretty far out there yet, and so the studies are really just happening. I think something that we've pointed out many times with this virus that puts us a little bit of ease with that is that children ultimately do very well with this. Now, when we start to talk about high-risk children, that may be a different discussion, and that's where that population will be looked at first, kind of as the adults have been.
Yeah, and those discussions are kind of already happening at a state level in terms of, as Adam was talking about, some of those other chronic illnesses. If individuals have chronic illnesses, if children have chronic illnesses, those will be some of the first people that we vaccinate in the 16 and under and the 18 and under crowd.
Now, someone asked about testing positive for COVID for 6 months. I guess their provider said that if they had COVID, that they could still test positive for 6 months. But then they wonder how they've seen people within that time frame, I guess, get diagnosed with it twice. So just confused on that.
Sure. So the tests that have been created for COVID, the PCR test in particular, is the one that we would be talking about in this case, is so specific that it will pick up what are called remnants of the virus. So once our body has created the immunity and protects us against the virus isn't just magically gone and there's no trace of it. There's trace amounts, or what are called remnants of the virus. And in testing individuals that have been positive and recovered, there is the potential that they can continue to test positive. The recommendation that we follow is we don't retest patients for 90 days that have tested positive, because and there's a high likelihood that they will test positive again, and that's the same infection or the same virus hanging around in the body. It's not a reinfection, which is the scary term that gets thrown out there. It's the same infection. It's just being sometimes your immune system can dip due to stress or whatever is going on, and infection can start to kind of ramp back up. But it's really the same infection that your body is fighting over a long period of time. So we don't recommend retesting. There are instances where, in working with a team of physicians, that they will make the determination to retest for specific reasons. And that might be like a monoclonal antibody therapy, that they feel like somebody's deteriorating. They want to get that test and then to move forward with a treatment plan. But in all, from a community and from a patient standpoint, once you've tested positive for 90 days, you shouldn't just go get retested. And if it's within our same system, they'll see that you've been tested, and they should tell you that there's not value in retesting.
That's, if we go back to summer months, that's one of the reasons why we've never really endorsed the concept of a test of cure,
Right.
Meaning that you have had the illness, you've been in quarantine, and then before you return back to work that you get tested. It's also one of the reasons that we really don't endorse some of the optional methods of getting out of quarantine that have been suggested. CDC has come up with 3 or 4 different methods of how long you can quarantine, and then early methods to get out. The problem with that really is that if potentially you were positive at some point in time, there is no test of cure. There is no, my test is negative, I can return back to work. So keep in mind the utility of those tests, how those are used, and what the limitations of them are, because we don't want to give people false information with regards to being cleared of the virus. It doesn't work that way.
Okay, those are all the questions.
All right. Well, thank you very much for joining us this week. We'll be with you again in a week. And please continue to make plans as far as your spring break and time off is coming up to be safe within your circle and your group. And we'll see you in a week.